Good afternoon, everyone. I want to thank you for being here. Today's June 26th, 2020. Hello. Want to say I am joined by our Councilman at Large for Division B, Scott Walker, our Councilwoman for District 5, Councilwoman Jennifer Van Rankin, along with our Louisiana Department of Health, Region 1 Director, Dr. Joseph Kanter, Jefferson Parish Coroner, Dr. Jerry Stanovich, our Sheriff of Jefferson Parish, Sheriff Joseph Lapinto, from JEDCO, our Economic Development arm, Jerrybologna, and our Emergency Management Director, Joe Valiente. So let's go over the current case count as of yesterday. Jefferson Parish was carrying 9,074 positives since this started in March, with 480 deaths, unfortunately. And the African American population still holds true at about half of those deaths at that rate. So we're looking back to April 2nd, which was the height of the coronavirus in Jefferson Parish. On that day, we had 745 cases. Starting at around April 20th, for 2 months until this present week, we've been able to plateau at a level of somewhere around 30 to 60 cases a day. Of course, the daily spike is up and down. If you look at the 5-day average, which sort of smooths out the data, it is in that area of 30 to 60 cases a day. That's certainly a wide swing if you compare us to smaller parishes, but a smaller parish might, be a 5-person difference every day. We're a parish of 430,000 people. So of course, the bigger the parish, the larger the swing of those daily cases. So I consider it that we were doing well. We were plateauing at a level within the 30 to 60 a day range. Unfortunately, though, this week, we have had an increase in cases. For 3 days this week, we have had total daily cases of over 100. So we want to get on top of this very proactively. That's why I stand here today. We do not want this. We want this, as I've said, to be a blip on the screen. We don't want this to be the start of something totally different. After all of our efforts, after all of our hard work, we need to get on top of this immediately. We do not want this virus to start running rampant in our community again. We have been through too much. So, from the beginning, Jefferson Parish, personally, I have been taking the stance to be very aggressive on testing. We were fortunate to get one of the first federal pilot sites at Ilario Center. I have fought to keep that site alive and well. We run that site daily. Well, we just recently, in the past week, started closing on Sunday. Starting at 8 a.m., we have Joe Valiente, his staff is incredible, has been running that site. So when I talk about testing sites, it's not only the local doctor's offices and the hospitals that contribute to the Jefferson Parish testing number, it is my staff, our staff, that I have said, I want to test any resources coming to Jefferson Parish to test. I want to partner with them. We've partnered with LCMC in the past couple weeks. We've partnered with Ochsner even more. Right now, there's testing going on as a partnership with Jefferson Parish. My staff is out scouting right now for where we're going to go next week, working with Ochsner. Where's the hot spot? Let's set up a mobile testing site. We have been doing that for weeks. I think today's testing site, a Jefferson Parish site, partnered with Ochsner, and of course LCMC as well. We've done 15 sites. We're right now planning for another 5 in the next couple weeks. So when I talk about testing in Jefferson Parish, again, it's not just the hospital systems testing that's on the dashboard. I personally have taken a very aggressive role in testing. We have over 75,000 tests in Jefferson Parish, the highest in the state by far. Because I knew even when we were in the stay-at-home mode, that testing was our way. When we started phasing out, we would be right on top of it, and we would be able to see what was going on. So we saw that back in March, to keep the testing at a high level. Even after we've plateaued, we've kept very aggressive testing. And I want to say that. Having said that, knowing that we have 75,000 tests, and the way I look at it, I don't care what the dashboard, I don't care the numbers, testing reveals the positive cases. And that's what I want to happen. And that's the position we've taken. So I don't want people to say, well, Jefferson Parish is testing so high, that's why we have a high number. There is something different going on now. Testing high, we've been doing it. There is something different going on now. We can see that with the higher numbers on the dashboard at the Louisiana Department of Health. I see it anecdotally. I see it at our own testing sites. Yesterday, we reached capacity. Yesterday, Ilario Center was higher than it's been for a long time. We're seeing it. I've just personally This past weekend, I've had 4 friends call me about where to go get tests, okay? Parents, my age, parents of teenage kids, where to go get tests. So that wasn't happening in prior weeks. So there is definitely something different brewing now in our parish, and we need to get on top of it. Much has been made about parties in the last weekend, especially in New Orleans, in Baton Rouge, at the bars. Make no mistake, Jefferson Parish residents were at those parties. I personally know that, okay? So even though the media is saying this happened in Baton Rouge and it's happened in New Orleans, we are a region. Many of our Jefferson Parish citizens might have had the virus transmitted to them from another parish. Many people from other parishes get infected in Jefferson Parish. We are a region, and we need to be careful of that and cognizant of that. So I don't want people to say, oh, that party was in another parish, it doesn't affect us. It absolutely has affected us in Jefferson Parish. Yesterday, I requested a meeting, and I want to thank JEDCO, I want to thank the Louisiana Restaurant Association, the Chamber, the JBC. I asked for a quick meeting with the industry. Where can we make a difference? I wanted to get in front of the restaurants and the bars, because as we've gone to phase 2 and as we've increased the density there, and Dr. Kanter is here, as we've seen the new cases come in, it has been the young people, the 18 to 29-year-old age group, that is sort of leading this new trend that we're starting to see that I hope we're able to stop very quickly. Those are the people that are frequenting a lot of these restaurants and bars. Those are the people who are employed at these restaurants and bars. So we wanted to try to at least get in front of an industry very quickly to say, and I asked Dr. Kanter to be on that call, so they had the latest information of what we knew from the medical community about how to help us get control of this situation. So I want to thank them. We had a call with over 50 participants yesterday. It was a very good call. Many of them are working on campaigns now. Many of them are doing things. There was a lot of business leaders on that call, and everybody's working to get on top of this. So again, we're trying to quickly meet with people who are going to make a difference in the industry. Having said that, today, right now, we are introducing something we're calling the COVID Compliance Hotline, the See It, Say It Hotline. As we know, we're asking businesses, we're hoping that all of our Jefferson businesses are complying with the density requirements, the reduced density that we're in phase 2, and requiring their employees to wear a mask, encouraging patrons to wear a mask, separating their tables, putting up plexiglass, doing all those things that we know our community needs our businesses to do. I will say that so many businesses are doing it well, and some businesses are not. And the power of the pocketbook is what I'm asking everybody to pay attention to now. Everybody is so powerful with the wallet they have in their purse, in their back pocket. If you go into a place and this business is not doing the standards that we need in this community, walk out and go somewhere else. Have it start in the morning with your coffee shop. And if they're not paying attention and they don't care enough about our community, go bring your business to a coffee shop that does care about this, because we're all in this together. It affects everyone. Do it at your grocery store. Do it where you buy your clothes. Do it at your restaurant where you pick it up. Do it everywhere. Make yourself powerful with your wallet. Please, I'm asking everybody, let's reward the businesses. Let's let those businesses get our revenue. Those are the people who care about our community. Those are the people who are in it with us. Let's reward the good businesses. So having said that, we're starting a COVID compliance hotline, a See It, Say It hotline. The number is 736-6929. Again, area code 504-736-6929. Catherine Topoulos here is our director of property maintenance and zoning. We are pivoting quality of life inspectors who normally go out and look at property violations to visit businesses. Now, I want everybody to understand, I am not the enforcement arm. I don't have the power to go out and write a misdemeanor. Our campaign is one of education. Our campaign is one of asking people to get in compliance with this. Our campaign is to persuade people and to ask them to be part of our community and to do it right. And so I'm asking people, they can also go on jeffparish.net and get an online form. And we're going to take the complaints and we're going to send out our staff to go visit these businesses, notify them that they have a complaint, give them the best practices material, and ask them to comply. So that will be happening. And I'm going to ask people, if you see a business, a grocery store that I go to does it well. They wipe down the carts You walk in, they have plexiglass, their employees are wearing masks, but maybe the person at the register has their mask on, just not covering their nose. Don't give us those complaints. Let us work on the egregious offenders. Let's take our scarce resources for this large parish and work on the worst offenders first, okay? So tell us the businesses that aren't doing it right, and let's just, for now, focus on those and not the minor violations, okay? So, again, I'm meeting with those inspectors today in a little while to go over it. This is a brand new thing we're starting right now at this moment to work with partner agencies. Egregious offenders who just won't comply, who just are not with us, I will personally ask the Louisiana Fire Marshal to go out and cite them. And that is the enforcement arm on this capacity. That is the enforcement arm on these COVID compliance measures. And I will personally do that. So again, we'll look forward to that. The COVID compliance hotline, 504-736-6929, or our online reporting form at jeffparish.net. So the next thing, I can't stress enough, please wear your mask. We need everybody to wear a mask. With this virus coming again in our community, even if you go into a place, you might know what the capacity is, it might look a little too crowded, you're stuck there, put the mask on. It's gonna prevent you from spreading that virus, and it is the right thing to do. Also, to remember to social distance, wash your hands. Let's go back to the basics that we know. Let's go back to the basics that allowed us to get to phase 2, and hopefully let's re-engage so we can move forward controlling and managing this virus that we know is in our community for a very, very long time. Testing, I want to update on where we are with testing. So testing sites today at Ilario Center right now going on. Celebration Church, this is our Jefferson Parish partnership with Ochsner at the Kanter campus right now. I was there yesterday, packed, line right down the plaza of the mall. So again, those are indications that I know something's brewing in this parish. They met capacity yesterday, but they are testing right now. It'll start, no, I'm sorry, they're not testing right now. It starts at 1 and it goes to 7 until capacity reached at Celebration Church at the Kanter campus. Johnny Bright, again, a partnership with Ochsner, next Monday and Tuesday from noon to 6, and Pilgrim Baptist Church in Kanter next Wednesday and Thursday from 9 to 4. What worked well, we started a new model with Ochsner, is we went to a site for 2 days, and then the next week we went to the same site for 2 days. So if you were found to be positive at that site, that next week your family and your contacts could go back to a familiar place, or you could direct them there, and it worked very, very well. It was a great model that we tried out. And it worked well. So again, the ones that I mentioned, not the Ilario Center, you have to be 18 and above, but the other ones that are mentioned, Celebration Church, Johnny Bright, and Pilgrim Baptist Church, you do not have to have symptoms. You don't have to have symptoms at Ilario either, but you only have to be 2 years old and above to go to those sites that I mentioned. We are also partnering for a blood drive with the Blood Center. Good news is if you go and give blood next time, you get a free antibody test. So that will be July 18th at Park Playground from 9 to 1, and Saturday, July 25th at Pontiff Playground from 9 to 2. And you can look at thebloodcenter.org to sign up. And I also want to remind everyone, like I do all the time, please fill out your census, 2020census.gov. Our response rate is still just 62%. We need people to fill out the census. It is critically important that everybody do that. So with that, I also want to invite Dr. Kanter up, and he has the latest information about my very serious concern about where we are with our positive cases this week. So Dr. Kanter, who is our Region 1 Medical Director. Dr. Kanter.
Thank you, Madam Parish President, and thanks for the leadership that you've shown. And really, I wanted to thank all the officials that are gathered here. You know, Jefferson Parish, as President Leisheng mentioned, is leading the state in testing by a lot. It's the result of a lot of hard work by the folks gathered here, and they really do deserve a lot of credit. They've also given out a ton of masks and have provided a lot of good education to constituents in Jefferson Parish, and they deserve a lot of credit for doing a really great job under difficult circumstances. So I'm appreciative of what everyone here has done. You know, a couple things have developed across the state over the past couple weeks that I wanted to review. Number one, the decline in cases and in virus spread that we enjoyed in Louisiana is reversing. reversing over the past couple weeks. Our progression into phase 2 reopening has not gone well. Now that trend is also evident here in Region 1. I will tell you it's more acute elsewhere in the state. It's very bad in the Lafayette area, in the Lake Charles area, and in the Alexandria area. But it's not limited to those areas. We are seeing increasing cases here in Region 1 as well. And there's been a lot of talk about what happens when you do more testing. Do you find more cases? Yeah, you do find more cases, but there's a lot more to the story than that. And Madam President mentioned this. If it's raining outside and you choose not to look out your window, it's still raining outside. That's the situation we find ourselves in. And when you see not just increasing cases go up, but when you see the percent positivity of all tests being done go up, and when you see more individuals presenting to emergency departments with symptoms suggestive of COVID go up, and when you see people hospitalized for COVID go up across the state and in Region 1, those are strong and undeniable signals to us in the Department of Health that the virus is spreading, that it's not just an artifact of doing more testing. There is virus spread. It has correlated since we've progressed into phase 2, and it's concerning. And you don't have to look very far to see what can happen. Houston is in big trouble right now. Arizona is about to exceed their hospital capacity. That's where we were, back in late March, early April. Florida, really concerning examples, and we do not want to go back on that track. Now, the other big development that's happened over the past couple weeks is we have seen a dramatic rise in cases in young adults. Individuals aged 18 through 29 now constitute the fastest growing demographic group of new cases in the state. And I'll tell you, this past Tuesday, when we had a lot of cases announced, 150 new cases in Jefferson Parish, 40% of those were individuals aged 18 through 29. And there's been a lot discussed about these super spreader events, the bars by LSU, house parties, graduation parties across New Orleans. Sure, there were events in Jefferson Parish that I don't know about. All of those events, the ones in Baton Rouge and New Orleans, all had individuals who were residents of Jefferson Parish there and come back. So we're seeing this big rate of growth amongst young adults. Some people say, what's the problem? Because most of the time, young people do okay. And I wanted to talk about that. Number one, most of the time they do. Most of the time is not all the time. On average, young adults clinically do okay with COVID, don't suffer the worst consequences, but that does not mean that that is an absolute. And I will tell you, not only do I have plenty of case reports that I could share of individuals who are in that age bracket who got very sick, I can tell you I personally cared for a young adult who died of COVID right in front of us in the emergency department from cardiac manifestations. So there are individual case reports. It's not an absolute guarantee that you're going to do well. But the second issue is, if you think the COVID is going to stay within you or your age group, your friend circle, if you think it's going to stay right there, you're naive. This virus has a real tendency to spread. That's what it does. And it might not be about people aged 18 through 29. It's about exposing their parents, exposing their grandparents, exposing a clerk at the grocery store, exposing somebody else that they come in contact with on the street. That's how this virus spreads. And I will tell you, we should expect in the coming weeks to see cases in the older age group increase because they're spreading from that younger age group. And we should expect to see deaths go up as well. That's what this virus does. We lived through it 2 months ago. So today there are 480 deaths from COVID in Jefferson Parish alone. That's 10 higher than the number of people who died of opioid overdoses in all the state last year. And I think that number is going to go up. So this is a loud wake-up call to everyone. We have lived through, as President Li Sheng said, we have lived through what it looks like to be in the middle of this virus spreading uncontrollably, and we don't want to go back there. So people really do need to be cautious. They need to take personal responsibility, And when they go into a store or a building, you got to insist that everybody around you is wearing a mask, because that's the only way that you're going to protect yourself. It really does make a difference. Every day we learn more and more about how effective universal masking is. And so I want to make a personal appeal to people: insist that those around you wear a mask, because it's going to be important for your own safety. Thanks, Madam President.
Thank you, Dr. Kanter. Next up, we're going to have our Jefferson Parish Coordinator, Dr. Jerry Stanovich.
Thank you, Parish President. Dr. Kanter gave some great data. I can tell you in the last 2 weeks in Jefferson Parish, we've had only 5 deaths. It's 5 too many, but compared to where we were a few months ago, it's very low. That said, just like Dr. Kanter said, I expect those numbers to increase, because it takes a few weeks from exposure, and in most cases, for people to unfortunately die. I'll tell you, I expected that when we reopened that there would be an increase in cases. But I'll tell you, as a doctor, I am surprised and scared by how quickly it has accelerated in the last 5 to 7 days. And one of the things that concerns me is it doesn't take you long on social media to scroll down and see people blaming irresponsible young people, protesters, or people with privilege as to why this happened. And I'll tell you, pointing fingers does us no good at any point, okay? Maybe a year from now, but not now. Now we are where we are, and we have to deal with it. I think there's a shared responsibility within the community to deal with it. We need to focus on the things that we know that works, okay? Masking, obviously. Social distancing, obviously. Avoiding unnecessary large social gatherings. And most importantly, protecting the people among us in our families and our community that are most vulnerable. And we've got to concentrate on that. The good news is, 2 things. Number one, our healthcare system is much better prepared to deal with it because they've been through it once before. Number 2 is we, as a community, are much better prepared to deal with it because we've done it before, and we need to do it again. Thank you very much.
Okay, next up we have Jerrybologna from JEDCO.
Thank you, President Lee Shang, for your leadership. On behalf of the entire business community, we want to thank the thousands of businesses that have reopened, and especially those that have done so safely. It's our assertion that the consumer is going to drive the economic piece of this recovery. And so we're imploring those businesses that are not taking the necessary precautions to do so, because the consumer is not going to support those businesses that aren't. These are not expensive solutions. Mask wearing, hand washing, they're very simple. They're very simple things, and they're proven to be effective. All of the precautions that our businesses can be taken are easily spelled out in the Jefferson Back to Business Guide that is available in a number of places, including the JEDCO website at jedco.org. We implore you to please do your part, and we implore the consumer to support those businesses that are not only keeping their customers safe, but their employees safe. With that being said, we also realize the importance our business community has in providing government in deriving tax dollars that provide government services. As such, we need to do our part to support our local businesses and spend our money here locally. So JEDCO is proud to partner with the parish, with many of the organizations and business groups throughout the parish. And next week, we will be unveiling our Spend Local JP campaign. And that will be to encourage all people to support our local businesses, to spend local, but most importantly, to support those businesses that are taking the appropriate precautions. So we look forward to launching that next week. And again, thank you, President Lee Shang, for your leadership.
Okay, just want to let you know, Dr. Kanter just told me that today's Jefferson Parish count is going to be probably 95 cases. So again, this is not a 1 or 2 day blip we're seeing. This is almost 100 cases again today. So reiterate the importance of us getting on top of this. We know all those new infections have an ability to infect new people, so we have got to get on top of this, get back to the basics that we know, get back to the basics that let us get this far, to not have this prolonged virus stay in our community even longer. So, with that, are there any questions?
I know you're encouraging, your folks to wear face masks, follow social distancing guidelines. At what point are you potentially considering making it mandatory in JP to have acceptance of face masks?
Yeah, so, throughout this thing, and the question is about masks and whether we're going to require it to be mandatory. Throughout this whole time, and I want people to understand, Jefferson Parish does not have a medical department. So our medical department is Louisiana Department of Health. All of our citizens pay taxes to the state. It's a vast, very strong organization. Without a medical background, I'm going to follow the advice. To me, it's just good public policy to follow the advice of the experts. Personally, I wear a mask all the time. I'm out in a mask. I want to be the role model. It's the right thing to do. It's the common sense thing to do. I watch TV and it's like, oh, it's a political thing. That is ridiculous. Okay, I'm a Republican. I wear a mask. It makes sense to me. Of course. So let's just cut to the chase. It's just the responsible thing. It's the common sense thing to do, and we're stressing it. I think if you ask the state and if you heard the governor, it's the enforcement piece. Public policy means something. If you can't enforce it, you're kind of coming out the gate, So I can't stress enough, wear a mask. Short of us having somebody from the government follow you to make you wear a mask, that's not the issue that's going to solve it. We need people to believe in it. You can enforce it, and then when you go away, if they don't believe in it, they're not going to wear it. And so I can't control everything, but I'm strongly suggesting, asking, pleading, everyone needs to wear this mask. The whole community is involved in this. You just can't live a life and think you're immune to it. And look, the economy is important. It's not a economy versus a medical care thing, and I hate those discussions because it doesn't have to be. It's the same solutions. Keeping our daily case count low is the right medical choice, and it's the right economic choice, because being able to put food on the table for your family is very important. And so we don't have to have this, are you on this side or you on this side? The solution is the same. We've got to keep the transmission low in our community, and then the economy will take care of itself. We'll have jobs, we'll have people secure in their homes, being able to provide for their families. They're very critical to us as a community, both sides of that.
Maybe a question for you as well as Dr. Kanter. In light of what we are seeing in Texas right now, particularly Houston, are you concerned about hospital capacity with the surge in cases?
So I actually was just on the phone with someone from Oshner. Certainly they're seeing an uptick. Right now, they're not concerned about capacity. We're not up there, and I'll let Dr. Kanter speak of it. But this is the other issue I want to say, and we got fortunate as a community. I remember during the height of it, I did a Zoom call. I can't remember what holiday it was, but we planned a big Zoom call, sort of a family reunion, so to speak, with my cousins in Texas. There's about 15 of us on the call, and I was shocked at the density of Houston. They weren't seeing cases, but they were shut down, and we were comparing what their phase looked like, but they were not seeing cases. We were fortunate as a community that when it hit us, we shut down. Places like Texas, they shut down when it wasn't there, and now they're coming out and they're trying to regain footing in their economy, and now they're seeing the spike. So in one sense, our region in Louisiana, especially the greater New Orleans area, was fortunate that our high cases matched our crippling economy that we had to do. It matched up. And so we were fortunate in that sense. Let's not go backwards now. Now we see the uptick. Let's correct it right away. So we can say our timing was a good timing, the way this happened, as if you compare us to other cities around the country, we got lucky that our spike matched our economic shutdown. So with that, Dr. Kanter, you might want to give more specificity to the question. You might want to repeat the question.
Thanks. To repeat the question, it was about how our hospital capacity is looking right now. It's looking okay. We're not yet threatening the capacity like we were, back in late March. A couple things to that. The hospitals made a lot of investments a couple months ago when we were in the throes of this. They built a bunch of respiratory isolation wings. They did some pretty creative engineering modifications, HVAC system modifications. And those investments are still there. So we have that backbone. We also still have the field hospital and the convention center. It's been decreased in size substantially, but we were able to ramp up that staff if we need to on pretty much, short order if need be. So we're not bumping up against that capacity in terms of general beds, ICU beds, or ventilators. We are looking at hospitalizations right now as a prognostic indicator because, like we talked about with testing, when you have more patients presenting to hospitals and being sick enough to be admitted with COVID, that's a very strong signal that the virus is spreading above and beyond anything that you would see with just increased testing. So we're following the hospital measure very closely for that reason now, but we're not yet threatening capacity, thankfully.
Any other? Yes. So when we entered this phase, we were able to start with baseball, and yes, there has been some positive cases related to that, and we're taking all the precautions. There was a coach that came down with coronavirus. We sent out a memo. Our recreational director, Mario Bazile, has been in front of that. There was another child that was diagnosed with coronavirus on a team. He notified that team. So we're doing all of those things. And recently he put out another detailed letter to our coaching staff. And I said, we're going to do this as long as we can. And if it overwhelms us, we're going to have to stop. I mean, baseball is not something that's critical to our community. Certainly, it's something that we all love. But if it's not managed well and it's not managed properly, and look, it's gathering people together, and it's difficult. You have the kids playing, and they're in a dugout, and they're close, and then you have families who, of course, I was in the sports world. These are people that you haven't seen for a long time. You want to socialize with them, and that's a huge network for your life right there, and they haven't seen. So we're managing that. We started out with bleachers being available, and he, sort of put X's and separated that. Our director believes it's just best to shut down the bleachers, have people bring their lawn chairs. It's going to enable a little bit more social distancing. So we're doing all of those things, creating a no huddle environment with coaching. I said the kids huddling, you just can't, I know you're re-envisioning baseball without a huddle, but these are the things that we're going to try to do. Of course, with COVID in the community, there were a couple of instances, and we're going to monitor it very carefully. And if it gets to be where we can't manage it and manage it well, and our staff can't manage it because we can't police everybody, then we'll have to reassess it. But I'm hoping we're able to get through it, and it is being managed as well as it can be. But we're going to see. If it gets to be the new hot zone for us, baseball in Jefferson Parish, then we're going to have to reassess it. Any other questions? Okay. Thank you all so much for being with us. Thank you.